Good afternoon and welcome to the show. I'm Luke McCormack. During today's show, we will discuss critical issues facing government and industry leaders in using information technology to improve healthcare and healthcare services. With me on today's show are Colonel Kevin Seeley, Deputy Chief Information Officer, Defense Health Agency, Jeremiah Cunningham, Senior Director of Sales, Federal Citrix Government, Sean Kelley, Vice President, Business Development, Military and Veterans Health, Leidos, and William Von Alt, Staff Engineer for Splunk. Well, healthcare is a big subject, and certainly IT is a big subject. I think about personalized healthcare, I think about telehealth, I think about IoT and embedded systems in these environments, nanotechnology, big data, case management, of course the famous blue button. We've got to make sure all this is secure, and I'm told we're spending over $3 trillion in this area. So let me start with you, Colonel. Can you give us some progress, tell us about some progress that's happening over at the Defense Health Agency in regards to IT and health IT?
When I think about the promise of technology in healthcare, for many years it is to deliver better services, quality of care, cost and access to the patient. Getting the right information to the right customer, the right patient, the right provider at the right time in the right way. We have invested quite heavily in technology over many years, and we are achieving some of that. We have several enterprise systems that we use to do health information exchange. So primarily with our electronic health record, our legacy electronic health record, we've connected that up to several state HIEs, health information exchanges, and we exchange data at the state and regional HIE level, as well as with the Veterans Administration, to ensure that patients and providers are getting access to that their care information.
So maybe you could tell the listening audience, where does DHA fit into sort of the VA's healthcare system versus the military healthcare system? How does DHS, what role does DHA play in that?
So the Defense Health Agency is just that. We're the health agency that delivers care to the military service members, as well as their beneficiaries, the family members. The Veterans Administration is geared toward taking care of veterans after they get out of the military. It's important that care is seamless between the two healthcare systems. So as we look back at the years, Congress required us to do health information exchange to make that record more seamless, and we've done that by sharing information back and forth between the VA and the DoD.
Fantastic. Sean, how about at Leidos? Tell us about what's going on at Leidos, what's going on in regards to healthcare and progress in regards to IT and the delivery of those capabilities across our community.
Yeah, Leidos, the health group, we don't look at ourselves just as an IT organization. We look at ourselves as a healthcare organization, and how do we assist with making sure that patient care is delivered? How do we help with? We help with disability exams. We have supported the legacy Alta at DHA for 28 years, I believe. We've been a significant integrator in the VA space as well, so we support both sides of that. And what we just try to figure out is, how do we help our customers deliver healthcare better, more efficient, and making sure that when we're there helping them, we're a thought leader and we're supporting what they need, not only today but in the future.
So you've been doing that over the course of 20 years, both on the military side, on the veteran side, it sounds like.
I don't believe as long on the veteran side, but on DA side, we started with CATS and then helped with Alta.
CATS is what for the listening audience?
The Composite Healthcare Computer System.
Okay, all right, so it's a system that they use to...
It was one of, Vista is probably the first, but sure. CATS was a very early adoption of a healthcare record.
Fantastic. All right, Jeremiah, when I think of Citrix, I think of a lot of different things that Citrix does from a technological standpoint, but maybe you could share with the audience sort of what does Citrix do in regards to healthcare, and then tell us about some progress that's being made.
Well, I think when you're right. When a lot of people think of Citrix, you think of certain things, and Citrix has grown over the years to help deliver healthcare solutions. And we've always been part of the infrastructure, and for many years, the federal healthcare has been a significant customer of ours, both DHA and VA. now it's delved into delivering the apps that clinicians need securely over across several networks, whether it's on-prem, cloud, what have you. So it's really evolved much more than infrastructure. It used to be we were just part of the infrastructure. Now from mobility, clinicians to other people from on the VA side, even for the veterans, for families and like that. So web browsing, some of the things that the commerciality of delivering healthcare solutions versus just being part of the infrastructure is probably the biggest change.
Yeah, I would think, with a lot of this stuff going in a sort of a mobile direction and telemedicine, et cetera, where Citrix would play a huge role in that, right? Personalized medicine, getting access to my records remotely, et cetera, would be a big role that Citrix would be playing both in the private sector and the public sector, I would imagine.
Absolutely, because it's one is delivery, but two is that aggregation and collaboration of the data that you want to deliver securely. So you have to aggregate it securely and then deliver securely as well. So absolutely, we're a big part of that.
Sure. Okay, Willam, how about at Splunk? Once again, this is a technology that we're very familiar with across the community in a lot of different dimensions, and I'm sure in regards to big data and analysis, et cetera, that's where Splunk probably plays a big role. But tell us about Splunk and what Splunk does in regards to IT healthcare and the progress that you guys have made.
Absolutely. The big data that you referenced, Luke, certainly is perhaps largest within the healthcare space, right? Because we're talking the patient healthcare records, we're talking the infrastructure upon which those systems ride, the security and compliance thereof. There's so many different data points out there in healthcare IT that both affect the patient as well as the underlying operations. So from Splunk's perspective, we're seeing organizations more and more adopt a proactive approach to managing that data, to collecting that data, and to being able to operate on it for the improvement of both their patient-facing services, make sure that access to those electronic health records are robust and resilient, secure, but also to affect business operations in terms of claim processing. Are they efficient? Are we detecting anomalies and potential fraud in the process? So many applications of that data that is being generated and collected by all the various systems.
And I would imagine, the analysis of big data and then doing some AI on top of that and making smart choices about, whether it's a claims process or what have you, is a big part of what Splunk is being used for in the healthcare industry.
Absolutely correct. We had a reference use case from a partner just earlier this year. Cerner, very large healthcare organization, processing millions of transactions across thousands, tens of thousands of customers, and using some of that AI and machine learning capabilities that you referenced, able to, in near real time, detect anomalies, detect potential fraud, and act on it rather than post facto.
Sure. Well, let's talk about programs and maybe some specific successful programs. And let's start with you, Sean. Can you identify a specific program that you can share with the community that Leidos has been a part of that comes to mind in regards to a success that you guys have had in respect to healthcare IT?
Absolutely. I think going back to what we talked about when we started was, taking a healthcare system and being a partner with our government side and taking CHCS and installing something was originally paper and going from paper to electrons back, now we're talking over 20 years ago, is an amazing progress. And I think that is what has set us up to be where we are today. Adopting a state-of-the-art medical record like Cerner in the DHA space, or even now moving towards the VA space, it takes a whole lot of things to happen within the ecosystem to make that happen. Standardize of data, training of folks, the change management process. An adoption of an electronic health record to go from paper to electrons is a huge, huge effort. And I think in a partnership with the military health system, DHA, that has been one of the proudest things we've ever been involved with in supporting the DHA.
Right, and I'm sure making sure that you have all the security standards and capabilities on top of that to secure that environment is a big deal as well.
And that's changed, right? I mean, 20, 30 years ago when CHCS was envisioned, the security threats of that day are much different than they are today. I mean, we're living in a connected world. CHS was dummy terminals and really internal to the facilities. So it was somewhat of a closed system. Now we're talking about an interconnected system that goes worldwide.
Right, and as it goes worldwide, lots of opportunities for making sure that you can secure that environment. Jeremiah, how about at Citrix? Can you tell us about a specific program that you guys have been involved with that you've been able to enable the healthcare capability across one of our departments or agencies?
Well, I think with Colonel Seeley and Sean here, I'd be remiss not to speak to DHA, DIPSM contract over the last couple of years, delivering health records to DHA, and that's moved forward enough to where that's saying the VA is going to duplicate that from the Cerner context. So I think in delivering and being part of that infrastructure, delivering the medical records and apps and data really, and securely, and having a secure perimeter around that is probably one of the most significant programs that we're actually in.
Wow, so and obviously doing it very securely, and that's one of the things that Citrix is well known for. Colonel Seeley, how about at DHA? Can you give us a specific example of a program that you guys are implementing that you'd want to share with our audience that is happening at Defense Health?
Well, I think the big one that was mentioned is many know that we have.
I'm sorry, what is that?
That many are aware of is the implementation of Cerner. So we have partnerships. For those that were at our industry day yesterday, the Defense Health Agency had industry day, and many of our partners there that are in our environment and providing us services. As I said, we are rolling out a new ecosystem of software, hardware, and solutions services that include a lot of the products that we're talking about today. But Cerner is the big one. That we call it MHS Genesis. The MHS Genesis is kind of the cornerstone of the future strategy. And as we roll that out, we really are looking at developing a more ubiquitous ecosystem of applications. So we're taking some of our legacy platforms, some of the enterprise systems that we have that also leverage some of the software that we're talking about here, and put them into place so that they provide a more ubiquitous access to patient information.
That's a huge undertaking, right? Do you have a timeline as to what's the time frame that DHA is looking to implement that?
We have a schedule that we're rolling out. As many know, part of the transition is transitioning the infrastructure that supports the Genesis and the data center there, and the other part is actually rolling out the Genesis product itself. And the timeline is kind of in a state of flux. So we've rolled out the first 4 sites in the Pacific Northwest, and we do have an upcoming schedule laid in that we're going to roll out next wave in the next several months, next year, and then the rest of that will be laid in as we develop our action plan.
So a lot of hardware refresh and rollout, and then a lot of software capability on top of that. So yeah. Fantastic. William, how about at Splunk? Can you share an example of a program that you've been involved in that you'd want to share with the listening audience in regards to maybe with the department or agency where Splunk's been really utilized to provide healthcare IT?
Certainly. 2 quick examples come to mind, and sort of 2 different use cases: operations from an IT perspective, and also security and compliance. So the first is another shout out to DHA and Colonel Seeley's programs. Splunk is the central platform that's part of the monitoring stack for the Genesis system and that infrastructure that it rides on. So being able to help the teams very quickly and in some cases proactively identify any hiccups along the way, troubleshoot and triage them quickly, ensure uptime for the mission critical systems. That's from the IT operations perspective. Switching gears over to a security and compliance use case at the Department of Health and Human Services, we're seeing an adaptive response capability from their security teams roll out. Centers for Disease Control was one of the first or earliest adopters of that, but we are seeing it spread across the operational divisions now of HHS, where it's not just about monitoring, looking for the bad guys anymore, but being able to take a informed, quick, and automated response to mitigate the threat as it comes in. And so HHS and its operational divisions is having a large success with that as well, integrating other technologies with the Splunk platform.
I would imagine that is technology that can be used in a lot of different places. I think about things like CMS and Social Security and everyone else, not even just healthcare, right? A lot of places that have benefits that need that type of analysis where it makes sense, a good reuse case for that type of capability.
That's correct. Yeah, being able to get those early wins and then replicate it out across the enterprise, as you said, not maybe just for healthcare, but across all their operations as well.
Sure. Anywhere that you're providing issuing a benefit, I'm sure there's an opportunity there to make sure that's being done properly. Well, let's talk about lessons learned. There's always, as we're rolling these things out, you guys are at the forefront in regards to technology. DHA, you're right smack in the middle of this in regards to, you've been at this quite some time. And I always like to share some lessons learned with the audience so they can think about that. And let's start with you, Jeremiah at Citrix. Can you think about some lessons learned that you'd like to share as you're probably working with a variety of departments and agencies, certainly on healthcare IT, but a lot of other types of similar type of capabilities. Something you'd like to share with the audience as far as some patterns that you see and some things that would be helpful for them to understand.
I think some of the lessons learned really is you are working with an agency, especially in a program or contract basis. You start to go down the technology road because you're delivering a technology. I said, but you have to keep focusing on what the outcome is, because the technology should and can change, and your outcome, intended outcome, stays the same. So I think you really want to keep focusing on the intended outcomes. So a lesson learned really being is, stay focused and don't continue down a technology, because a lot of times, a lot of people in the technology world like to, just keep fixing that technology or making that technology work better in that particular environment. And I think focusing on intended outcomes is probably the best lesson learned that you can stay with.
And I would imagine that this technology has evolved considerably over the last 5 years, right?
Absolutely.
In respect to the type of underlying technology that you're using to secure that. Is Splunk involved in that at all, as far as this evolving mobile technology and doing any kind of analysis on that? I'm just curious as to, does Splunk get involved in sort of the mobile play in respect to this evolution of technology?
Absolutely. So, data is data, right? Whether it's coming from a mobile device or platform or your enterprise systems as well. We've had a capability now for several years that came as a result of an acquisition to be able to ingest end user experience data and mobile crash data directly from the handset platforms into Splunk. And then more importantly, correlate that with the other data sources that you're collecting, right? Whether they be from logs or network traffic or security devices within the enterprise. So mobile is just an extension of the enterprise, and it's here today. So Splunk absolutely allows you to capture that and analyze that data the same as any other.
Fantastic. Well, we're talking about lessons learned, and we'll continue with that. But right now, we got to take a short break. You are listening to the Federal Executive Forum on Federal News Radio, 1500 AM, and federalnewsradio.com. Welcome back to the Federal Executive Forum on Federal News Radio, 1500 AM, and federalnewsradio.com. With me on today's show are Colonel Kevin Seeley, Deputy Chief Information Officer, Defense Health Agency; Jeremiah Cunningham, Senior Director of Sales, Federal Citrix Government; Sean Kelley, Vice President, Business Development, Military and Veterans Health, Leidos; and William Von Alt, Staff Engineer at Splunk. We were talking about lessons learned, and let's go to you, Sean, in regards to lessons learned at Leidos. You guys have been at this quite a while. You described to our listening audience that, Leidos has been in this business of healthcare for over a decade, maybe a couple decades in some cases. Probably got a lot of lessons learned. Can you share some of that with the audience here?
Well, I mentioned earlier CHCS, then the migration Alter, and we are partnered with Cerner for the Genesis project. And so taking what we've learned over the last almost 30 years for Genesis has been paramount as we try to apply those. But I think the biggest lesson learned is change management. You can't underestimate what it takes for the staff to adjust. And there's some staff that have been around for CHCS, Alta, and now are living with the third version, which is Genesis, and making sure that you incorporate them into the process. If you forget the people part of people, process, and technology, you're really going to have a hard time with any IT project.
So kind of focusing on the people and making sure that we leverage that depth of knowledge, if you will, across this community, very important as the technology changes and some of the processes change, having that historical information in regards to the people and can reflect back and demonstrate some of the lessons learned to the rest of the community.
Yeah. I think it could be easy to say, well, we're going from one EHR to another. How hard could it be? But the technology has advanced so much over the years. And so you even with the newer generation that has been almost born with phones in their hands and they're connected all the time, there's still a learning curve that you have to take into account and make sure that they're comfortable with it.
Sure. I would imagine, Colonel Seeley, that you've got a lot of lessons learned at the Department of Health in regards to Defense Health, in regards to what you guys have discovered along the way as you've gone on this modernization journey. Would you like to share some of that with our community?
So I'll capitalize on some of the things these gentlemen said and talk about strategic discipline. Staying the course with a massive transformation, migration activity. It's easy for us to kind of get taken off course. So to talk about what Sean says, Defense Health and Veterans Health had really been a mainstay for electronic health records and really getting out there and doing it in the 80s and the 90s, and really I saw a lot of transfer of information and knowledge to industry, and then industry really took that, I think, in the early 2000s, and we've seen that kind of with ONC's help, really kind of leverage those lessons learned. Looking back over that entire history, I think it is now time that we kind of take advantage of all the lessons that industry has learned over the last 10 years, 15 years, in implementation, broader implementation of electronic health records across the entire nation. So we're looking to take advantage and leverage the new technologies that are available, and a couple of examples of that are the security aspect and providing cybersecurity in that sensitive healthcare information environment. The DHA has stood up, using lessons learned, DHA has stood up a cyber operations center and able to take advantage of the tool sets that are available now to do monitoring and security incident and event management across the enterprise. So our focus now is looking at, rather than standing up silos of IT across a large global enterprise, we're trying to bring that in with the technical transformation and what I previously referred to as the medical community of interest network and the desktop to data center approach.
And I would imagine with this tectonic shift in technology that there's been considerable analysis done on how to secure this environment and this new sort of way of operating. How long have you all been planning for this new transition that you're in the process of making? How long has that been in sort of the planning cycle? I just want the audience to appreciate sort of the thinking that's going into this.
So when the DHA was stood up, we looked at the entire technical portfolio across the ecosystem, and it was determined that we needed to do something. As Ed mentioned yesterday at our industry day, one of our big problems is what I call IT urban sprawl. And that is IT in silos that's not well connected. It's not, we don't leverage the full value of the information and data that we have stored across all of our systems. We have interconnects and we do share data, but it's time to kind of leverage that. I call it leapfrogging. We would like to leapfrog into the next generation of healthcare.
You see that quite a bit, telecom industry, et cetera, where things get leapfrogged.
Absolutely.
How long has DHA been in existence, just for the listening audiences?
DHA was stood up, initial operating capability in October of 2013.
Okay, so not that long ago.
Not that long. Planning started on the technical migration, some of the activities that had to take place in order to stand DHA up. Interestingly enough, for those that aren't aware, the DHA was created out of moving personnel and resources from each of the services. So it was originally called a shared service environment. So the Army, Navy, Air Force all contributed out of their medical, the Surgeon General's staff and the Defense Health Program, portions of staff. Talk about cultures, bringing all of those cultures together to create the DHA in 2013. But the health information technology piece went all in, where others were had longer term plans. On 1 October 2013, health information technology is all in, because we understand that we have to build this foundation in order to build up the rest of the healthcare system. It is an essential support function, a critical support function for military health.
A lot of culture dynamics, a lot of cheese moving, and then a lot of new technology being introduced into the environment. So a real leadership opportunity there, let's say. William, how about at Splunk? Tell us about some lessons learned that you're encountering at Splunk that you'd like to share with our community.
Sure. To echo from Colonel Seeley's use of the word data silos there, that is absolutely what we're seeing in terms of lessons learned is the need to break down those silos, to be able to have visibility across what has historically been segmented and isolated pools of data for a large reason due to security, right? Historically and even to some extent today, that is how industry has chosen to secure its data, is to isolate it, segment it, and protect each pool of data individually. But that certainly limits the value then that an organization can extract out of that data when you want to perform some sort of cross-cutting analysis. And sometimes the information sharing, the exchange agreements that are in place, they're just not good enough, technically speaking, right, to be able to analyze the data that lives in different places owned by different individuals or organizations. So we're seeing many of our agencies now move towards breaking down those silos to be able to perform more effective, more efficient analysis of the data and to leverage it for multiple use cases we talked about earlier, right? This isn't just security data, this isn't just IT operations data, this isn't just mission data anymore. It can now be leveraged and used across all and many more use cases.
I think just trying to manage all that data, all these devices that are now producing these records and capability in a variety of ways, both operationally and from a business perspective, and just trying to collect all that data, analyze it in a proper kind of way is a daunting task, right? And
it certainly can be. And that's
technologies like Splunk really help.
It's another lesson learned that with the proliferation of Internet of Things, of medical devices coming online and sharing their data or making that data accessible, we need new ways to manage that data, right? New ways to store it, new ways to access it.
Sure. Well, let's get into some priorities, and let's start with Jeremiah, you at Citrix. What are the top priorities for you in regards to Citrix, a company, and what do you see your customers asking for that you guys are focusing your attention on?
I think what what customers are asking for, certainly should be our priority. But I think what customers are asking for really is choice. And because they have environments that are already there, they may change, but the customer is asking for choice, and the customer is asking for a rock solid user experience, and to deliver both securely, right? So those are our priorities, is to do just that. we want to deliver a technology stack that drives innovation as well. But when you do that, you talk about the culture, and you talk about, and when you talk about culture, really you talk about an opinion, right? Someone has an opinion, and we'll term that as, a cultural issue. Sure. And that opinion may say, okay, I want to do it one way versus the other. So Citrix really allows for that choice, whether it's choice in device, choice in how you aggregate the data, how you want to present the data, how you want to manage or view the data. Choice in device, or it could be choice in in cloud environments. So all those things would be the choice, delivering a choice to the organization, delivering the user experience to the end user, and delivering that securely are really the top priorities for Citrix.
It sounds like too. Sean, how about at Leidos? What are the top priorities at Leidos, and what are you seeing as far as your customer base?
Our customer base is military and veterans health, and for my group. And we see as our priorities looking at the full spectrum of care. As you mentioned at the beginning of the program, healthcare costs are estimated to be around $3 trillion. 86% of that is chronic conditions. We expect prescription costs to raise, I think is the number I saw was 136% by 2025. If we don't get control of our cost of healthcare, then healthcare is going to become too expensive for the ordinary American. And Colonel Seeley, whether it's Colonel Seeley or whether it's the VA CIO, they're looking at how they're going to be able to control costs, because IT is very expensive. It's usually a very big item. So how do we help them? How do we become a thought leader in that industry and make sure that we're not only bringing what the today problem is, but helping our customers go to the next level and look at what will be needed, like you mentioned, how much technology has transformed in the last 5 years. So what's going to transform in the next 5 years? I think we're seeing the cycles shorten every time we go around them. And so how do we help our customers? So priorities, data. We've mentioned data on a few occasions. How do we get that data where it's usable and actually can get into artificial intelligence data analytics? I think that's really the key for the future. How do we make sure that the care for our active duty service members, their families, the retirees, but also our veterans, how do we make sure that we're giving a solution that actually brings value, a value-based care, making sure that customer engagement or patient engagement is at its highest quality. I think those are our priorities as we look at it.
Driving that cost down and making sure you're giving a good experience to the patient, if you will. Absolutely. Colonel Seeley, how about at DHA? What are the priorities that you see in front of you in regards to DHA?
Well, there's foreseen functions and some of those are just budget. We have to pay very close attention to that. So as we walk forward and look at our strategic investments, our disciplined strategic investments, we have to do a dollar by dollar analysis. And so second part of that is ensuring that we have the right partnerships with industry, and that we have conveyed the requirements that we have appropriately to industry as we intentionally design, deliberately design for performance of the future state health information technology ecosystem. So looking at those, reducing variance as a subset, and increasing standardization to create enterprise solutions. And that I would say, echo that there's lots of opportunity there for everyone to kind of understand where we're going. As I mentioned yesterday, we are changing, and we truly appreciate vendors that are coming along with us and changing with us and responding and reacting to those needs that we have as a military health institution.
And the industry day that you had yesterday, about how many people showed up to that?
There were approximately 700 in attendance, and there was another 200 or so online.
So tremendous interest. And the purpose of the industry day in general was to
share our requirements, our future way ahead, and get an understanding of where the DHA is moving to strategically.
Fantastic. And it sounds like you've got a lot of folks that are interested in this capability and helping provide this type of solution to the community at large, right? William, how about at Splunk? Can you give us some examples of some priorities that you have there at Splunk in regards to maybe what you're hearing from your customers, what you guys are thinking about, what's going on across your environment.
Absolutely. It's quite simply, it's being able to deliver on the priorities that our esteemed colleagues and customers here today have identified. You know, the National Institutes of Health published a strategic plan for data science recently. And in that plan, they outline 5 key initiatives or focus areas for them that really, I think, resonate throughout all of the healthcare industry, public sector and private as well. They include a improvement of infrastructure and security for their data programs, breaking down those information silos that we've already talked about, increasing access to analytics tools and ramping up the analytics data science workforce as well. And then lastly, making available easily accessible, reusable data sets, right, that can be shared interagency or among agencies. So again, being able to deliver on the promise of those initiatives and what they can lead to for the betterment of patient experience and healthcare in general, certainly a focus of Splunk, and we aim to do that through enabling technologies, right? Technologies that we are developing right now today, either organically in-house or through acquisition, that include supervised and unsupervised machine learning, automation capabilities, the artificial intelligence that was touched on earlier through AI operations, but really being able to support our customers' initiatives by taking as much of the workload burden off of them as possible, letting the computing power that they have harnessed, be available to them to make those analyses and ultimately the decisions that result from them easier, faster, more efficient.
Are you seeing this, Sean, in your customer base as well, as far as being able to take this data, analyze it in a much richer way and in a more sophisticated way so that they can make some good decisions?
Absolutely. We have 2 programs, one in Point Loma with the Special Forces, and we also have one up in Grand, Connecticut with the Submarine Force, where it is actually human performance work, where they take data in real time and actually help those ensure that there's peak performance within the Submarine Force and the Special Forces, but also too in making sure they can return to duty as quick as possible. I mean, labs that can test people in conditions as high as 130 degrees and as low as 0 degrees, and making sure that understanding what those conditions and how they impact performance, as well as similar studies that are done on the Submarine Force. And so as we can bring that data together and really look at it holistically, I think we've made some tremendous progress in those areas for those customers.
And I would imagine that you're seeing this across your community, right? I mean, it's not just in the healthcare, but it's in the rest of the defense environment and the commercial environment and the civil environment. Is that a fair statement?
Correct, Luke. It's the tagline is data-driven decision making. Everybody wants to move in the direction of making more informed and better decisions based upon the data at hand. But to Sean's point, doing it in real time and near real time, right? Not the batch processing or the looking backwards of yesteryear.
Look, I think that where we struggle is it's not an absence of data. It's too much data, and trying to figure out what data can actually be useful and what we can do to get to those real-time decisions. And I think that's a big part of the problem, especially when we deal with data that's siloed. When that data is siloed or not available to everybody, you may feel it's secure, but what are you hindering in the process by keeping it siloed and not part of a bigger project? And I think DHA has done a really good job with centralizing the data with the repositories, and I think that's helped with their readiness and performance.
Well, maybe we'll talk about that a little bit when we come back from break, but right now we're going to take a short break. You're listening to the Federal Executive Forum on Federal News Radio, 1500 AM and federalnewsradio.com. Welcome back to the Federal Executive Forum on Federal News Radio, 1500 AM and federalnewsradio.com. With me on today's show are Colonel Kevin Seeley, Deputy Chief Information Officer, Defense Health Agency, Jeremiah Cunningham, Senior Director of Sales, Federal Citrix Government, Sean Kelley, Vice President, Business Development, Military and Veterans Health, Leidos, and William Von Alt, Staff Engineer at Splunk. We were talking about big data and the analysis of big data and top priorities there. Colonel Seeley, I'm just curious at DHA. I'm sure that big data and analysis and how you're collecting big data is a big deal over there. Any sense about that in regards to one of the priorities?
It is, and ensuring that we have that data in a secure place, and reduced numbers of platforms to make it a little more ubiquitous and manageable, and also secure. Security of all of the big data. We say big data, but it oftentimes is aggregated in a repository and data warehouses. And we have a lot of good data that we use to analyze for population health and clinical decision support. And we use that quite often. But protecting that data and applying what we call our risk management framework to ensure that everything that we're doing, all of the systems that we own, all the applications, data centers, the networks, are all secure. That is something that I think our industry partners have listened to in recent years, and understanding that we've graduated from DIACAP to a risk management framework. And although it's really challenging in some senses, that I think vendor communities from Internet of Things, medical device vendors, and large-scale system application vendors understand the importance of risk management framework. So I'd add that to one of our priority
Quite a
areas.
collection of data that has to come together, and then using different types of tools to analyze that. Well, let's talk about challenges that need to be overcome. And let's start with you, Jeremiah, in regards to Citrix. And what do you see as challenges out there that need to be overcome as we sort of look forward into the future that you all are experiencing at Citrix, that you see happening within the community?
I think some of the challenges really come around, in trying to, Citrix provide and deliver a secure digital workspace, right? So in doing so, we want the user to think about doing their job, doing the work at hand versus worry about the technology. So that's one of the challenges, is to, ensure that experience where technology is not the main function, but doing the operational function. Especially when you get to healthcare, you have the clinician. They're providing medical care. They shouldn't have to worry about the technology. So I think that's one challenge, to make sure that that's seamless. The other challenge is bringing in new technologies to the healthcare environment, and increasing bandwidth in the rural areas. Healthcare in some areas is much better because of getting information and technology to the clinicians, in areas not. So bandwidth, bringing new technologies into the environments, and those things would be some of the key.
Deal. Sure. Sean, how about at Leidos? What do you guys see in regards to the challenges out there that need to be overcome to sort of move this ball forward?
I think overall, for the healthcare industry as a whole, is cybersecurity. We're seeing a drastic increase in ransomware attacks on hospitals and healthcare institutions. We really have to get a hold of this. I don't personally believe that cybersecurity is the same across the board. I think healthcare has a special mix. If things go wrong, you have patients' lives in your facilities. And as mentioned earlier, there's so many things. A medical device can last almost 20 years on the network. It's a heavy operational or capital expense that we invest in. And so in some organizations, it could cost billions of dollars to just replace them all into the latest operating system, and that's not possible. And so you have those. We're now, because of ONC rules, we have folks now mostly on EHRs. Even the small doctor's offices are now in EHRs. So the healthcare data is very attractive on the black market, and it's being gone after. And now it's in electronic format. And so cybersecurity has to be important across all of healthcare to make sure we can progress forward.
Yeah, collecting all that information, storing it so that you can analyze it, but it's so important from just patient care and patient safety issue becomes a real important situation. How about at Splunk? What do you guys see as far as the major challenges out there that just you guys need to think about, and that you think need to be overcome in regards to pushing the agenda forward?
The biggest challenge that we tend to encounter, or that our customers tend to encounter, is that access to data. Right? We've already talked a lot about the data silos, and being able to get a holistic view, my marketing folks would want me to use the term single pane of glass, but being able to look across the silos, as we've already talked about, and get actionable intelligence from that data that's being generated and collected is just very tough today, right? That's the next obstacle, the next challenge that needs to be overcome in order to maximize the value that they can realize at the agencies.
Is that something that you guys are looking at introducing some new technologies for, or is that just something that the way these things are being implemented, or how do you solve that?
It's all of a people, process, and technology problem. And there are certainly technologies out there, Splunk being one of them, that can help to combat that, distributed search and look across multiple pools of data, different geographies, different locations. That's the easy part, is the technology. People's mindsets in terms of how we protect, how we store, how we manage data, and then just the processes that are built around that in terms of being able to change the course of the ship, if you will, right, to do something different than we've done in past decades. Is the challenge.
So it's a little bit of both, it sounds like. Colonel Seeley, how about at DHA? What do you see as sort of the challenges out there as you look towards, this large implementation that you're facing today?
Yeah, I caveat that in saying that each a technological experience is a personal experience. Sure. For a patient or a provider. We select our platforms, whether it's Android, iPhone. We come to expect a certain level of performance. We also come to expect that the technology will be of value to us. Going back to what I said at the start, getting the right information to me, whether it's coming out of a big data platform and using AI and machine learning and telling me the things that it believes that I need to know, but also the choices that I make in getting that information. So the ability to take this new world that we have with all of this data and making it valuable to me as a patient, or me as a provider, or me as a technician that's looking at a cybersecurity dashboard. Those are things that are essential, I think, to allowing us to truly leverage technology the way it is today. We do have, as Sean said, information overload, alert fatigue, all of these things that are coming at us, all these things that are coming at our providers. This where we're at right now is a true opportunity, I think, to make a real difference in how we deliver healthcare. To ensure that providers can customize their experience in the new platform, patients can customize their experience in the new platform to get the information and data that's valuable to them and the things that they want to know. The questions, what do we need to ask of the data, and how do we need to present it to them? And all of the industry partners that we deal with are really asking those same questions. It is a complex challenge to get that right information to the right customer and the right patient and the right provider at the right time. And I think as we've continued to ask that question, we will get the answer as we move forward and build out the new foundation.
Yeah, I think personalized medicine, and patients want choices in a lot of cases. All right, we've got a little bit under 8 minutes, and I always like to end with sort of painting a picture of the future. So let's start with you, William, at Splunk. What does over the horizon look like to Splunk?
We want to see our customers be successful with making the best, most well-informed, data-driven decisions they can. And that speaks to solving some of the challenges and obstacles that we've talked about here today. It speaks to some of the futures with machine learning and AI ops. But there are some big problems out there, specifically in healthcare and healthcare IT, to solve. I know conversations that I've been involved in recently at some of the highest levels of the Health and Human Services Agency, looking at, as one case example, the opioid epidemic that America is facing. The department is taking that very seriously with their approach to leveraging data and data science methodologies and tools to be able to address that more efficiently and more in real time. They've partnered with industry and academia partners as well, and so that's the panacea. That's our perfect world, is to be able to say, you have the resources available, you have the data available. Let's make sure that it's accessible. Let's make sure that it's usable, and let's make sure that you're leveraging that to your best ability.
Sure. Jeremiah, how about at Citrix? What's the future hold? What does the horizon look like as you look over it?
Well, the future is bright, which is a good thing.
Yes, as always.
We really at Citrix, we look to power the delivery of healthcare solutions, really. And I go back to securely deliver the data that's needed and how you access that data. And we go back to the user experience and really the choice in the environments and choice of the individual clinician, what kind of devices, or choice in cloud. And really, I think the future really is a journey for all of us. When you're taking a journey, picking your partners, having the right customers, and having that relationship. Citrix, 25-year-old company, still right-hand quadrant in many sectors of Gartner. So we can deliver the solutions, and we see it as we can partner to meet the challenges that these large undertakings are going to have. So I think delivering that end user experience is going to be critical for us in a very secure way.
Providing choices and making sure it's done securely is a big deal. Sean, how about at Leidos? What does the picture look like as you guys look across the horizon?
I think Jeremiah and the Colonel have kind of touched on it. This healthcare is personal. And I think that when you look at companies like Amazon, Apple, and Google, by the way, who are all now entering the healthcare market, I think that their success has been based on creating a personalized experience for their users. I think Leidos is in that ballpark as well. We want to bring solutions to the table that our customer need, but also that our customers want. The patient today is more educated than they've ever been before. They walk in with believing what they already know their diagnosis is to a doctor's visit, based on what they've been able to find on the internet. But we equally, as one of the largest system integrators in the marketplace, have to make sure that our customers are equipped with the latest and greatest information as well, making sure we're working together with good partners and making sure that the right information at the right time for the right provider, for the right patient is available. And so Leidos wants to make sure that we are also engaging not only our customers, but also their customers, the patients, the service members, the retirees, the veterans, to make sure that they have what they need when they go into the respective facilities.
Full end-to-end experience, right?
Yes.
Colonel, how about at DHA? What does it look like once this current environment that this project you're embarking on is fully realized? What does that future look like for
Luke,
the patients, the soldiers, et cetera?
I think you just said it,
Yeah.
end-to-end experience. If I look at what the future is going to hold for us as we build out kind of a new technology platform, the technology piece is going to be transparent and should be very quiet to the end user. The end user experience, the care that our soldiers, sailor, airmen, and Marines receive should not be dependent on the technology. It should be that technology piece and that layer should be transparent. They should be getting the information that they need. Their providers need to have that, whether it's in the battlefield as a battlefield medic, or whether it's their provider or care in the air, or patient transport, whether it's care at the VA, whether it's care at a managed care support contractor, purchase care is what we call it. Regardless of where our military members are in the system of healthcare, they need to be able to get their information in the right place at the right time. So their providers can make the right decisions, and they can make those decisions with their providers. So having that available to them without all the alert fatigue, I see in the future the patients owning their data and being able to provide that to whomever they need, and really understanding that it is their data and their information that goes with them throughout their entire life into the VA, and until they they pass.
And I would imagine that, there'll be a day where the service member can interact directly with the doctors, right? Through a telemedicine type of environment, using some of these mobile technologies, et cetera. You're seeing a lot more of that. Is that something that you would expect to see?
To open that up, we could talk about virtual health. I mean, we've been doing telemedicine for 28, 29 years, not new,
right,
but certainly underutilized. And I think a lot of the laws have changed in order to allow that cross-state, cross-border evaluation. But since we've been kind of tied down a little bit by some of those as well, because even though we're in a federal system, the virtual health still has laws that go along with that in the federal space. So I know that we're running out of time there, but
we could talk all afternoon about that, and I think that's an exciting topic. Maybe the next time we talk about IT healthcare, we'll talk a little bit more about sort of that whole emerging environment. Well, I'd like to thank today's guests for taking time from their busy schedule to join us for this program. I'd like to thank our sponsors for without we don't have a show. I'd like to thank the good people here at Federal News Radio that make our program so successful and enjoyable. And most of all, I'd like to thank the listening audience out there that tune in every month. You've been listening to the Federal Executive Forum on Federal News Radio, 1500 AM and federalnewsradio.com.